This is Radio Health Journal. I'm Reed Pence. This week, how the pandemic has changed the way we drive.
What we did see are these kind of drag racing opportunities where we would see drivers speed through cities like they're in a video game.
Less traffic and more crashes when Radio Health Journal returns.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
Europa's ocean might harbor complex life, and that's probably the only place in the solar system where you can say that.
The journey to Jupiter's icy moon Europa and why it matters. Then,
we have this mentality in our classroom that we're all in this together, no matter what it is, whether it's math class or whatever's going on in the world.
The benefits of learning back in person. I'm Marty Peterson.
and I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
When the COVID-19 pandemic first hit last March, stay-at-home orders created a dramatic impact. Depending where you were, the streets were suddenly deserted. Some radio stations stopped doing traffic reports because there was no traffic. Dr. Mitchell Doucette has studied some of the trends for the Department of Health Policy and Management at the Johns Hopkins Bloomberg School of Public Health.
When the initial stay-at-home orders were put in place, we saw dramatic decreases in vehicle miles traveled. And really, depending on your state, we saw decreases ranging from 30 to 60%. And specifically, the study that we did found that in Connecticut, there was about a 43% reduction in vehicle miles traveled in the post-implementation period of the stay-at-home order compared to the previous period.
In some places, traffic was down even more than that. In New York City, where the pandemic hit first, traffic volumes were down by 80%, according to the Rudin Center for Transportation at New York University. And with the disappearance of traffic came a drop in traffic deaths.
The pandemic really started impacting traffic trends in March and April. And in those months, we saw a dramatic decrease in the number of deaths on our road, a 7% decrease in deaths in March compared to the previous March, and an 18% decrease in deaths in April.
That's Ken Kolosh, manager of statistics at the National Safety Council. He says the decline in road deaths in the early part of the pandemic was certainly a good thing. But if you compare the drop in deaths to the much larger decline in miles traveled, you can begin to make some sobering conclusions.
In March, the month we saw a 7% decrease in deaths, we actually experienced a 19% decrease in mileage. In April, with an 18% decrease in deaths, we saw a 40% decrease in miles. And why that's important is if the relative risk of driving was staying the same, the decrease in deaths and the decrease in mileage should be about the same. When we see a bigger decrease in mileage than in deaths, we know the risk of death on our roadways is actually increasing.
And sure enough, as stay-at-home orders lapsed last summer and more people got back on the roads, the drop in traffic deaths disappeared.
Since June, we've actually started seeing very large increases in deaths on our roadway. The last month we have is October. We saw a 16% increase in roadway deaths in 2020 versus 2019. That same month, we were still experiencing around a 9% decrease in mileage traveled. So we experienced a 16% increase in deaths and nearly a 9% decrease in mileage. That results in a very large increase in relative risk. When we look at the mileage death rate, which is the best way to really gauge the risk of death on our roadways, that rate had gone up 27%.
That's just for October. For the whole year through October, traffic deaths were up 7%, while miles driven were down 14% compared to 2019. That computes to a whopping 24% rise in crash deaths per mile driven in 2020. Kolash says it's a situation we've never seen before.
It is not uncommon for economic conditions to impact motor vehicle fatality trends. During almost every recession, we see a decrease in miles traveled and a decrease in number of deaths on our roadways. In general, recessions help save lives on American roads. And we also generally see that mileage death rate that I've been talking about either stabilize or actually improve or decrease. So this current situation we see is completely unique. And we have never really seen such a huge decrease in miles traveled under such a short period of time, and then see that mileage death rate skyrocket like it is right now.
Ordinarily, then, fewer cars on the road mean fewer deaths. But with the pandemic, researchers have found that our roads were too empty.
The irony of traffic is that it becomes a bit safer when there is a bit more traffic because cars slow each other down. Although it's not ideal and nobody wants to be stuck in traffic, it does make it safer in general to have these cars naturally slowed down by one another.
Dr. Sarah Kaufman is Associate Director of the Rudin Center for Transportation at New York University.
What we did see are these kind of drag racing opportunities where we would see drivers race each other or do tricks or otherwise speed through cities like they're in a video game. People were increasingly driving recklessly. They were driving intoxicated and without seatbelts and speeding in extreme amounts. And so this driver behavior directly led to an increased proportion of deadly crashes.
All of this is borne out by Doucette's research spotlighting Connecticut. He says drivers there had few other cars to run into, so crashes involving two or more cars went down early in the pandemic. But crashes involving a single car more than doubled, and fatal single-car crashes went up more than fourfold. Kolash says research by the National Highway Traffic Safety Administration, or NHTSA, reveals some of what's going on.
First, they found that there's an increase in ejection rate. And what an ejection rate is the number of occupants in a vehicle that get ejected from their vehicle during the crash. And the reason that's important is that it's the best indicator that people are wearing their seatbelts. So compared to pre-pandemic times, it appears that fewer people are wearing seatbelts. And that is resulting in catastrophic injury and death, because whenever you get ejected from a vehicle, you have a very low probability of surviving that event.
The second trend that NHTSA found in pandemic crashes was riskier driving habits, like those Kaufman mentioned. A higher proportion of drivers are speeding, and more are speeding by a lot.
Not only are there some people who are speeding at a very high rate of speed, 100 miles per hour, but that's also increasing the mix of speed on our roads. So some people are driving the speed limit, some people are driving a little faster than the speed limit, and then you have another group driving much faster than the speed limit. And having that variability of vehicles driving at different speeds on the road also increases the risk. It's not good to speed, but it's sort of better if every vehicle is driving at about the same speed while on the road.
Here in New York City, we analyzed the speed increases at the Rudin Center. And on major thoroughfares, using data from INRIX, we were able to see that traffic speeds increased about 30% on major roads throughout New York City, including on Fifth Avenue, which runs through the center of Manhattan. Now, what's especially problematic is that there are still pedestrians out and about. This isn't an interstate going through the middle of a cornfield. This is a road going through downtown that sees pedestrians and cyclists and bus riders every day. So it makes urban environments much more dangerous.
NHTSA's studies also show that more drivers are drunk or on drugs. Not surprising, since alcohol and drug use in general have been up during the pandemic.
Smaller scale studies focus on a few emergency departments scattered around the country. That preliminary research has found that an increased prevalence of drivers who died during the crash and increased evidence that there was more alcohol and drugs in their systems than before pre-pandemic periods. So between not wearing seatbelts, speeding, and an increase of use of drugs and alcohol during the pandemic are probably some of the major causes impacting these truly unprecedented increases of death and death rates during the pandemic.
All of those are essentially risk-taking behaviors, so it could be that people with risk-taking personalities simply can't stay cooped up in the pandemic and go out to find open roadways. Or it could be that average people become less risk-averse if given the chance. Kolash says some communities have tried to limit traffic stops when they put officers at risk of COVID-19. Doucette agrees. Media reports indicate a lowered police presence during the pandemic.
When you have, again, a lower perceived threat of, say, receiving a speeding ticket, and you have less cars on the road, well, from a behavioral research perspective, both of those things would lead us to say people may be less risk averse, or they might be more likely to speed because of the road conditions that are in front of them.
Whichever theory applies, it appears to be continuing unabated. Crashes are still occurring at a higher rate than they did pre-pandemic. Just as we've gotten used to living with face masks, social distancing, and staying home, Kolash worries we may have gotten used to driving recklessly, too.
My concern is we all develop habits, and unfortunately it appears that many drivers are forming really unsafe, risk-taking habits. What happens when the pandemic is over, roads get more crowded? Will these drivers maintain those higher risk habits that they adopted during the pandemic, really making the situation that much worse?
Residents of urban areas had shied away from mass transit and have bought used cars in big numbers, so they may be slow to get off the roads anytime soon. But Kolash says there are ways to get drivers to be more responsible and cut the crash rate. One big way, making sure there are consequences for bad actors, and that everybody knows it.
Research has shown over and over again that high visibility enforcement is one of the more effective law enforcement strategies to help improve safety on our roads. So you do large-scale programs and even promote them on the media, letting the public know that speeding enforcement will be increased for the next several days and very visibly enforce the speed limit. So not only are you impacting the drivers who are pulled over, but other drivers see what's happening and change their behavior because they know that there is enforcement occurring on the roadways.
Something actually we're seeing in cities like New York and Chicago and probably elsewhere is an increased proliferation of speed cameras. This is a really good way to manage traffic speeds automatically without involving police and all of the aftermath that can come out of traffic stops, which we've learned in the last few years can be a tinderbox. And so having more speed cameras can help discourage speeding, which overall would improve street safety.
Doucette says throttling down available driving lanes, for example, turning a 3-lane road into a 1-lane road, could also help slow traffic down. There are likely many reasons for increased recklessness and more crashes, including some we don't know yet. But it's likely our new driving habits will take time and creativity to break. You can find out more about all of our guests on our website, radiohealthjournal.org. I'm Reed Pence.
Coming up, how to prove you've been vaccinated with an app when Radio Health Journal continues.
Coming up next week on Radio Health Journal.
Parkinson's was a very rare condition when it was first described in 1817, and now is the world's fastest growing condition.
Another pandemic on the horizon, Parkinson's disease.
Then using a gene test to create more individualized treatment for patients.
It can make a big difference in reducing this trial and error or random selection of medication that so many go through.
All that and more on Radio Health Journal.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.